I'm pretty sure that you have been in touch with this microscope since your first year of MBBS, but again in dermatology also this is having a very crucial important role which you need to know, which we are going to discuss in this video. So watch this video till the end to know all the important points related to the light microscopy. Hello dear students, myself Dr. Maddineni Srinivas. Welcome back to my channel. If you are not yet subscribed, please do subscribe so that you are going to get these awesome dermatology videos on a regular basis. So let us begin the discussion with the very basic introduction of the microscopy. But before that, you may be aware of the various advanced technologies or techniques which are available already, like immunofluorescence, direct, indirect, confocal microscopy. By the way, these are also by themselves very important topics which you need to know as theory questions. We are going to discuss them in a separate video. But here our topic of discussion is light microscopy, which is going to form the cornerstone bedrock for dermatology diagnosis for centuries and even further also. It's going to offer invaluable insights into the morphology and architecture of the skin lesions at a cellular level. Okay, and it is very non-invasive. Apart from the pathology department, they're going to use the microscope after taking the biopsy, which is an invasive procedure. But in dermatology OPD, if there is a microscope, you can definitely use it for so many other indications which are very non-invasive. And if your department has a microscope and if it is lying there in the corner having all the spider webs, then my suggestion, my order will be make use of the microscope. Okay, that is a very important diagnostic tool which is very easy, affordable, accessible. And also, like if a patient comes to the OPD, for example, I'm giving you pityriasis versicolor, take the scales, scrape the scales, put the KOH, observe it under the microscope, and you can also show the patient also what is there, and by this they will feel very confident. And also this microscope, after your PG, you can also buy it and keep it in your OPD also. It is not a very costly instrument or a tool, so it's very affordable, it's very cost effective, and you can diagnose very quickly. Send to the microbiology department for gram stain, the pus or whatever you call it, and you can also prepare 1 gram stain. You know the procedure in your MBBS itself, so you also observe under the microscope for yourself in the department. That is going to give you also the confidence of the procedure. If you do, you are going to remember for a long time. This is also very important. Even the staining procedures also might be theory questions, so be aware of this, right? And also it is going to help not only in identification of the skin conditions but also the hair disorders, and also some nail disorders also can be diagnosed with microscopy. So certain infections, inflammatory disorders and neoplastic diseases can also be diagnosed. So you should know some basic points related to how a microscope actually works, like how is the illumination, what is being focused, how is being focused, and what are the components of the microscope. Like in this picture, as you can see, I will only brief you about the most important parts of the microscope. Just follow my highlighter. So you can see this eyepiece. Can you see this eyepiece, or which is also called as ocular lens? That is the lens through which we are going to see the slide. Okay, and where is the slide kept? It is kept on the mechanical stage, and below this, what are the structures which are present? There is going to be a condenser. Okay, and below that, what is going to be there? There's going to be a light beam source. So these are the important points which you have to remember. And apart from this, there's going to be a fine adjustment and coarse adjustment which you can make, with the help of which the objective lenses, the magnification is going to change by the coarse and the fine changes which you are going to make in the focus, right? So these are the important points. Apart from this, this is this XY slide movement control. That is, the slide can move front, backwards, sideways, okay, with the help of this XY slide movement control, right? So these are some of the important parts of a microscope. Apart from this, the light source is, it could be the LED light or it could be the halogen bulb. Nowadays it's going to be the LED light. So the condenser, what is the use of this condenser? Like I have shown you here, this is the condenser which is present here, which again you can increase or reduce the intensity of the light which is coming from the light beam source. What is the use of this condenser? This helps in the focusing the light directly on the specimen and ensures the even illumination and the optimal resolution which you require at different magnifications. Okay, so this condenser, how much you should keep it open, how much you should close it, that depends upon what magnification you are actually working with. Okay, right. And the objective lens, like I have told you, this is the one which is going to magnify the image and it will help in bending the light rays. Okay, thereby you can precisely watch what is present on the glass slide. First, always you have to observe the structures whatever are present on the glass slide with help of the 4x. You should focus with 4x first, then slowly what you can do is point the lesion which you want to see, point the field which you want to see carefully and move to the 10x. So you can change the, you can rotate these lenses and you can change from 4x to 10x to 10x to 40x and finally to 100x. So this is how the objective lenses can be changed. That can be done by just rotating. Okay, so what is the actual interaction with the specimen which is going to help us to identify what is there over the slide? So first of all, the light transmission. The visible light passes through the specimen which is translucent, interacting with the different structures which are present on the glass slide, depending upon what sample you are putting, whether you are putting a scale on that, whether you are putting a pus on that or blood on that. Okay, depending upon that we are going to see the different types of appearances on the glass slide. So there is a concept like selective absorption, like for example certain cellular components of the specimen such as melanin and collagen, they are going to absorb specific wavelength of the light which inherently influences the image contrast. So basically we are going to see the structures because of the difference in the contrast from the other areas of the glass slide where the structures are absent, right? So and also we can use of this refraction, as light encounters the different structures, different refractive indices, that is the air tissue interface is going to create the bending of the light rays, because of which the image formation is going to happen. So this refractive index is also very important. Because of the refraction also we are going to see the different structures in a different ways. So finally the image formation observation, how we are going to achieve this is with the help of the ocular lenses or the eyepieces. They are going to further magnify the image whichever is already magnified by the objective lens, and it is going to throw that structure into the retina, right? Now coming to the enhancing, how can you further enhance whatever we are seeing in the slide with the help of the staining. So to enhance the contrast, we can enhance with the help of the different strains. They are going to reveal the hidden details which are present in the slide. And also we can make use of the phase contrast. This specialized technique exploits the differences in the refractive index within the specimen to create a contrast without the requirement of any type of staining. This makes it ideal for visualizing the live cells. So coming to the preparation of the specimen. So how can you prepare the specimen? We can make use of various techniques, like for example KOH mode, in which scales are going to be used most commonly. Also we can make use of the Zhang smear, in which you are going to take the base of the scrape the base of the vesicles which are de-roofed, and we are going to put it on the glass slide. We are going to put the gene sustain and then we are going to observe it under the microscope, Zhang smear. So in KOH, the potassium hydroxide basically is going to dissolve the keratin, thereby the skin, hair and nail, whatever keratin is there, it's going to be dissolved. And ultimately, if it is a fungal infection, like for example, if it is a tinea, then we are ultimately going to see the hyphae which are going to become visible, as you can see in this picture. So hyphae and also spores can be observed, as you can see in this picture, the hyphae are visualized. If it is a case of Pityriasis versicolor, because of Malassezia globosa, we are going to see the hyphae. Along with that, we are going to see the spores. So this combination we call it as spaghetti and meatball appearance. I hope you remember this. And coming to the Zhang smear, this is used in the case of viral infections like herpes simplex and also in the varicella zoster, where we are going to use a gene sustain and we are going to see the multinucleated germ cells, and also the acantholytic cells also can be seen, right? So this is a picture where you are able to see this multinucleated giant cells, which is in favor of the viral infection, herpes or varicella zoster virus. You should know what are the different types of light microscopy. So the first and foremost is the bright field microscopy, which is the most commonly used light microscopy, right? And it is used for visualization of the cellular components. Whereas this dark field microscopy, very interesting. So this in itself is a separate question or topic of discussion. So here we are going to see briefly what is it used for and how, what is the mechanism. Basically it is used in the case of the spirochetes, because they are very slender and we cannot identify them with the help of normal microscope. And the organism, of course, they are Treponema pallidum producing syphilis, Borrelia burgdorferi producing the Lyme's disease. So basically this dark field microscope is going to have this light is going to be scattered with the help of this cone of light, which is directed at a specific angle, because of which ultimately what will happen is there is going to be formation of this very interesting dark background. So this is very interesting. So can you see, this is a microscope where you are able to see this is the dark background against which the spirochetes are becoming very clearly visible, and even the movements can be observed. In the case of the primary syphilis, we can see the Treponema pallidum in a corkscrew movements in the dark field microscopy. That is the reason why it is investigation of choice in the primary syphilis. So this is also a very important point to remember. Next variant is the fluorescence microscopy. So in this, the sample is illuminated with a specific wavelength of light which excites the fluorescent structures. If at all they are there, they are going to become excited, because of which we are going to see a different color which is emitted. So by this different wavelengths of the light which is being emitted, we are going to see a different color altogether. And the classical utilization of this is in the case of, we can use in tinea cruris, where we can use fluorochrome, like for example this chalcofluor white, where we are going to see this. In this picture you can see this immunofluorescence can be observed after the KOH, or we can say fluorescence microscopy, right? Next one is a polarized light microscopy. Again, this is having so many uses, so many indications for this. This filters to analyze materials that possess two different refractive indices. That's why we also call it as birefringence. Birefringence, I hope you remember this birefringence for amyloid. Not only that, for others like collagen and also some hair shaft disorders also we can use this polarized microscopy mechanism. So in the case of the Fabry's disease, if you take a urine sample, we are going to visualize the Maltese cross, but that is not very routinely observed thing. So here you can see these are the Maltese cross in the Fabry's disease, but this is the important use case where you are able to see this tiger tail deformity on polarized light microscopy. And what is the disease in which we can see this tiger tail appearance in polarized microscopy? Put the answer in the comment section. I will just like the comment whichever has put the correct answer. And this is the apple green birefringence. I hope you all know this is because of the amyloid, the Congo red staining of the amyloid. So this is very basic thing which you have to remember. Next, general applications in the case of infectious disease for the microscopy. So in the bacterial infections, if it is Staphylococcus aureus, we are going to see the gram stain producing the cocci, and also there could be gram positive bacilli. All these can be diagnosed. And the fungal infections, KOH, like we have already discussed, and apart from that, even candida and also other dermatophytosis can also be diagnosed. Parasitic infestations, yes, this is very interesting. The skin scrapings from the burrows, if they are showing these Sarcoptes scabivar hominis, yes, the diagnosis is going to be the scabies. And if the pubic area, you are seeing some structures which are very tightly held onto the hair follicles, that is this crab loss, put it on the glass slide and you are going to see under the microscope this crab-like loss which is associated with pubic thyris pubis. Okay, pubic infestation by the lice. Okay, very important. Right. Next, in the case of the viral infections, the Zang smear, the herpes simplex and cytomegalovirus infections, these can also be diagnosed. Apart from the skin biopsy, we can use make use of the Zang smear also. Alright. And in the case of hair and nail disorders, like there is Netherton syndrome, where we are going to see this bamboo hair under the microscope which is also called as trichorexis invaginata, where the hair shaft is going to have some defects, because of which what will happen, this part of the hair, it is going to form the ball, and this part is going to form the socket, as you can see here, and this ball is basically the distal part of the hair shaft, and this is the proximal part, right? And apart from that, even the trichosis, that is splitting of the hair, can also be observed on the microscope. The naked eye we cannot find out. Onychomycosis, yes, obviously it is a fungal infection. So coming to the diagnosis with specialized techniques, like for example, already discussed polarized light microscopy. So it can help in observing the amyloid deposits in the patients of lichen amyloidosis. And also very important, surgery, most micrographic surgery, in which case we have to remove the edges where the malignancy could be there, which is looking normal clinically. So what we are going to do in stage wise during the intraoperative procedure itself, surgery itself, we are going to see the different sections of the normal looking skin under the microscope, and thereby we are going to decide whether this much excision is enough or we need to excise it further, especially this is used in the case of basal cell carcinoma. So this is a real time margin control can be achieved with this, right? Next, we can also have this dermatopathometry, where the cell size and density can be observed under the microscope, but these are, you know, a little bit advanced, we can say. And coming to the limitations of the light microscopy, so the depth of penetration is limited in the case of microscopy, so subcutaneous fat and muscle cannot be visualized, and static images are going to be seen. So it is basically a snapshot of whatever problem the patient is having. It does not capture the dynamic cellular responses which are going to happen and can be seen in the live status of the individual. And also interpretation could be dependent on the observers and experience and training, so that is there, but any time if we practice makes a man perfect, that is what you have to remember. And limited specificity is there, certain features may overlap across different diseases, so we cannot specifically say yes this finding is associated with this condition, it could also be there in other diseases, okay. So additional investigation might be required, immunochemistry and molecular tests. So what could be the future, like digital pathology may be the future, like where teleconsultation is going to become very easy by digitization of the slides. And computer aided diagnosis, so basically this we can also say the use of artificial intelligence can also be done in the case of the microscopy and the pictures for improving the diagnostic accuracy, right? And confocal microscopy, again this is a very important topic, separate question by itself, where we are going to see the high resolution, high HD 3D images of whatever we want to look at. So we are going to discuss this in a separate video. And super resolution microscopy, beyond the diffraction limit of the light, we can go in these type of advanced light microscopes. So to conclude, this is a cornerstone for diagnosis, and it's incredible for the versatility which it allows for diagnosing various skin conditions and also nail disorders and also hair disorders. And yeah, we can integrate it with various other advancements. We need not see the advancements as a threat for the light microscopy. It's going to stay in the department. Even NMC is also asking for the department to have one light microscopy of itself, right? So again, to just summarize the video very quickly, so it is non-invasive, affordable, accessible, and it yields very rapid results. Turnaround time is very less. Basically, it's going to produce the illumination which is going to focus the structures, and there is going to be contrast enhancement which can be done with the help of the staining. Bright field, dark field, polarized, these are the different types of light microscope. And yes, these are conditions which can be diagnosed in KOH, Zank smear, so the problems, and we have seen all this. So this is about the light microscopy. I hope you have got some important points which are very important from exam perspective in this video. If so, please do that like button, and also do share this among your friends, and if you have any further doubts you can put them in the comment section. And if you have not yet subscribed, please do consider to subscribe to my YouTube channel for getting more such awesome dermatology videos on a regular basis. Thank you so much. Happy learning. We'll meet again in the next video soon. Bye bye.